Okay, so we're hooking this patient up, getting her ready for surgery. So first I'm going to hook her up to the pulse ox. This just clips right on her tongue. Next I'm going to hook her up to our EKG. This has 3 clamps, so the white one is going to go on her right leg. And then the black one will go on her left. We're tying her. And then the red goes on her rear left leg. Spray each one with alcohol, so we'll start reading. Okay, and then I'm going to hook her up to our blood pressure monitor. So this cuff just straps right around her front leg. The capnograph. So this device goes between the ET tube and the breathing circuit. And we have the bear hugger for a warming device. She's got warmies underneath her towel. And then last I'll put the thermometer in her nose, and that's how we'll measure her temperature. So she is all hooked up to all our monitors and ready for the doctor to come in. So I'm going to go over a little bit more in depth some of the monitoring equipment that we have for surgeries. So the first one is going to be the pulse ox. So it's a clip that goes, it can go on the tongue, it can go on the ear, the toes, any thin part of the skin. One side has a light, one side has a sensor, and this measures the SpO2, or the oxygen saturation of the hemoglobin in the patient. The way you place it on is with the sensor side down from wherever your light source is, so that it doesn't interfere and it reads correctly. Normal readings are between 95% to 100%. Sometimes it can start to read low if it needs to be repositioned on the patient, or the tongue needs to be wet. You can do a couple things like that to just try and make it work better, and if that doesn't make it read higher, I would alert the doctor anytime it dropped below 95%. The next one is the EKG. So this has 3 leads. There's the white one goes on the right front, black goes on the left front, and red goes on the left rear. This reads the heart rate and shows the rhythm. You're looking for normal sinus rhythm or sinus arrhythmia in dog, and the normal heart rate for dog is 60 to 150, and in cats 120 to 180. I would alert the vet anytime it dropped below those areas for a dog or a cat. The next one is going to be the blood pressure. So that's this one. It has a little cuff that goes around the leg. That measures blood pressure. Normal values for the mean arterial pressure you want to be above 60. Anything below 60 I would alert the veterinarian, or anything below 90 systolic. The next is the capnograph. So that's this little one that goes between the breathing circuit and the ET tube of the patient, and this measures end-tidal CO2, or expired CO2 as the patient is breathing. Normal range for an anesthetized patient is 35 to 55 millimeters of mercury. I would alert the doctor anytime it dropped below 35 millimeters of mercury. There's also esophageal stethoscopes. We don't have one in this hospital, but it goes down the patient's esophagus and it measures the heart rate. You can hear the respirations if it's quiet enough, and it gives you an audible sound of the heart rate, kind of like the Doppler. So that would be a handy device to have. And then for warming or temperature, obviously we have the thermometer that reads the temperature, and then the warming device here we have is the Bear Hugger. It's like a warming kind of cloth thing that goes over the patient to help their temperature stay up. We also use fluid bags that we warm up in the microwave that we place between a towel and the patient. You don't want them directly on the patient, as you can burn them. Normal temp is 99.5 to 102.5. Anytime they dropped below 97, I would alert the veterinarian that they're starting to become hypothermic. That's when their temperature level gets dangerous. Okay, and I think that's all of the monitoring equipment for surgeries.